Hi, I'm Dr. Miner. Today I'm here with a patient that we are going to use some Botox for clenching and grinding. And we've done this in the past. And how was it for you? Did you notice anything?
That was fine.
Yep, okay.
Well,
So some people will notice sometimes that their jaw might feel tired afterwards, other times they don't really feel anything. And I tell people this is a lot like people that are getting treated for high blood pressure. You know, and they're taking high blood pressure medication. And they don't feel any different when they're taking high blood pressure medication. That's because they really don't feel the high blood pressure. And so how the Botox works is it reduces the muscle activity. And so with people that clench or grind, you know, it really takes a toll on the teeth. And so by reducing that muscle activity, you know, toning it down so it's not as strong, we help to preserve the teeth. Alright, so with clenching and grinding, there's two major muscles that we like to address. One muscle is up here, kind of in the temporal area, and the other is down here. And so we're going to put a little bit in each of these areas to help reduce that, help reduce the clenching and grinding and preserve the teeth. And so I've already marked the areas. I've felt for the muscles where we want to go. And I'm just going to go here, going to feel a little pinch. And put a little bit right there. And we'll do the other side. And a little pinch here. And there's a little bit of a crunch with it. That's the muscle that's really tight. And then down here, we're just going to go in. Alright, and that's it. So, how'd that feel?
that's fine.
So just like a little pinch?
A little pinch.
Little
That's all.
pinch. Pretty easy. So in Botox, you know, it takes about 2 weeks to fully kick in. We know it starts to take effect in about 3 to 5 days, and full effect is in about 2 weeks.